Well, welcome back. We are here today to start the first module, and we're going to talk about what is dementia. We hear the word dementia, we hear Alzheimer's, and it gets confusing. What are we actually talking about? So with me today is Heather Sloan. She's a nurse practitioner that works with me at Meadowlark Hills and has gained significant knowledge over the last few years in dementia care and really has taken a real interest in that. So we're glad to be here today. So dementia is really an umbrella term. So when we hear Alzheimer's or we hear maybe vascular dementia or Lewy body dementia, those are all subtypes of dementia. And the word dementia basically is saying a person who has cognitive impairment. They have difficulty problem solving, maybe. Probably the most common thing we hear about is short-term memory. They're losing keys. They don't remember doing something that they just did. Maybe they just told you something, and a few hours later or the next day, they don't remember saying that. Those are all potential features of cognitive impairment. There is a certain amount of cognitive loss just with time and aging, and this is experienced in misplacing your keys, but you end up finding them after you've searched for them for a while, for example. This is beyond what we would expect in a normal individual. And really your healthcare provider is the one that's going to help you differentiate between is this normal or not. There are some standardized tests that can be done to really help distinguish one or the other. But unfortunately, right now, we do not have the perfect test to tell us exactly which type or if a person has dementia. It really is a clinical diagnosis, one that really time will tell.
Right. Thank you for that. As society treks along here, we're starting to see a higher volume as well. So the prevalence of this problem is increasing. Probably the largest factor that's responsible for that is the aging of the baby boomers. So current statistics are showing that approximately 1 in 10 individuals around the age of 65 will be experiencing dementia concerns. That tends to increase as time goes on as well, and the statistic climbs to 1 in 3 at the age of 85. Due to this, there's more and more push to try to figure out how we should support these individuals and their caregivers as well.
Yeah. So during this module, Heather will be giving you a presentation over PowerPoint and really going into more detail into dementia. One of the topics she'll be talking about is just progression of disease. And so what can you expect as the disease progresses? And what things can you potentially do as the caregiver to help maybe mitigate some of those deficits that are starting to occur. She'll also talk about the different medications we have. And to be completely honest, the medication options we have right now are not wonderful. We really have yet to find anything that slows the progression of the disease. They may help maybe cover up that memory loss for a longer period of time, allowing someone to live at home a little bit longer, or avoid some of those more severe memory problems. But we have yet to find anything supplement-wise or prescription-wise that really treats the underlying condition. And so that leads us to you and really helping the loved one really do the best they can with what they have left as far as their cognitive awareness.
So as Dr. Flourish discussed, there's not much that can be done. So a large segment of this presentation will focus on supportive care measures, including both medications that can help with some of the symptoms that arise and where future research goals are aimed, various factors that you can try to focus in on to just support that individual as well.
Yeah.
Thank you.
Yeah. So as we get ready for this presentation, we as your medical experts, I would say, your healthcare provider is a very vital part of this care in helping diagnose, helping treat. But ultimately, the brunt of the work and the day-to-day falls on you. And we commend you for that, because there isn't much harder trial given than caring for a loved one suffering from dementia. So we hope you find this presentation valuable.